Good morning. Thank you for being with us this morning. It's good to see so many who are here with us. We're here to address what we believe to be one of the most important issues facing our community, our society, and that is the mental health and well-being of our young people. Whether it was the lingering isolation from the pandemic, anxiety about the future, the endless bombardment of social media, or something else. Our young people are struggling now like never before. The CDC mentions anxiety problems and depression as two of those common issues that our young people wrestle with. Depression, feelings of hopelessness and helplessness, and even suicide are draining our kids of their potential and fleecing their future. As a parent and a faith leader, I've seen how truly devastating mental health challenges can be to our young people and to their family. And we have a responsibility as a community to get them the help that they need. And here in Henrico, we are. Just last week, we expanded our mental health safety net when we cut the ribbon on the Youth Crisis Receiving Center at St. Joseph's Villa. Henrico was honored to work in partnership with St. Joseph Villa and the Virginia Department of Behavioral Health and Departmental Services. The Crisis Receiving Center will provide youth and families across Central Virginia with a place that's specifically designed to provide emergency mental health services for all of our young people. No longer will they have to go to a hospital emergency room to receive this kind of specialized care. Today, we're announcing another piece of our youth mental health puzzle. Before we get into the details, I'd like to say that I hope other communities, even the Commonwealth and other states and the federal government, will watch what Henrico County is doing. I truly believe that we are building a stronger, more comprehensive system of care that will be worth emulating. And as we know, the youth mental health crisis is not just an issue for Henrico County. It's an issue for all communities, all states, and the entire nation. I'd also like to acknowledge and thank all who are present, especially my colleagues on the Board of Supervisors. All are here today, and our partners on the school board. This demonstrates the unity and commitment of the elected leadership in Henrico County. It shows that we are serious about solving this very complex issue. We recognize that there are discussions occurring at the state level on addressing mental health. However, to be clear, we are not waiting for the General Assembly to act. As we move forward, I want to emphasize that we cannot do this alone. Our challenge is bigger than any local government and a school system can solve. We need the entire community, including private mental health providers, mental health care providers, primary and pediatric care professionals, the faith community, and especially our families. We're here to say that Henrico cares. This is the name of our plan to strengthen and modernize our local youth mental health care system. Of course, Henrico CARES is more than just a name. It's our truth, and it is a call to action. Our Henrico CARES plan stems from the work of the Henrico Youth Violence Prevention Committee, which was established 3 years ago. This task force includes representatives from schools, public safety, mental health, and others. They recognized right away that a focus on youth mental health was needed. This led to the creation of a steering committee, which includes mental health professionals from across the county and the school system, as well as other experts from the community. The committee has spent the past 7 months developing the plan that we will share today and will be implemented through our budget beginning this spring. Again, I want to thank the steering committee members, those of you who are in attendance and those who are not, for your diligence and your thoughtfulness, and especially your compassion. When it comes to our young people, Henrico does care. We want to help all of them and everyone to thrive and be happy and reach their potential. At this time, I'd like to invite School Board Chair Alicia Atkins, who represents the Varina District, to the microphone, and thank you.
Good morning. On behalf of my school board colleagues and everyone with Henrico County Public Schools, I want to echo our commitment to addressing the escalating mental health challenges that our children face. Suicide is now the second leading cause of death for Virginia children ages 10 to 14. So let the gravity of that sink in. Over the past 3 years, we have seen a staggering increase, around 42%, in suicide risk screenings by our school-based mental health providers in Henrico schools. And recent data from the Centers for Disease Control and Prevention reveals that 1 in 5 children in the United States grapples with mental illness, with over 60% receiving no treatment. Limited access, pervasive stigma, and systemic complexities pose formidable barriers to obtaining essential care. We must continue to strive for meaningful solutions with positive outcomes, and we are doing so right now. That is something to be excited about. Henrico CARES represents a pivotal stride forward as we introduce an initiative and an unprecedented partnership poised to bring about transformational change. Henrico CARES elevates mental health services in our schools and communities by enhancing access points and dissolving service barriers. We're shaping a new era of mental health care. This solution is championed by mental health experts, teachers, families, and our students, whose voices are growing in their plea for help. This effort builds upon Henrico County Public Schools' steadfast investment in student support and wellness, adding 65 dedicated positions ranging from counselors to nurses over the past few years. Our school board, our board of supervisors, our superintendent, Dr. Amy Cashwell, our county manager, John Vitokis, have not, will not sit by and watch. Instead, we stand tall, we lead the charge, and we take thoughtful, careful, we take opinions into consideration, and we're bringing about action and change. Collaboration amplifies our impact, extending our reach to serve those in need. Henrico CARES is how we carve a bold, vivid path towards progress that will leave an unforgettable imprint in Henrico and beyond. Now, it is my pleasure to introduce two individuals whose expertise has been instrumental in bringing the vision of Henrico CARES to life. Daniel Rixby, the director of Henrico County's Mental Health Services, and Liz Parker, the director of Student Support and Wellness for Henrico County Public Schools. The floor is yours.
You're good. Good morning. Good morning. Henrico CARES represents the most comprehensive and transformational project that I have been part of in my scarily 4 decades of doing this work. And it marks a significant milestone in transforming the mental health and wellness landscape for Henrico's youth and their families. The Henrico CARES initiative is a testament to our collective resolve, and at the heart of this endeavor is our steering committee, a diverse group of dedicated professionals who share a common vision, a vision to ensure that 100% of Henrico's children and youth have access to high-quality, timely mental health care and related services to meet their needs as they shift over time. We'd like to take a minute to recognize each steering committee member for their partnership and contributions to the development of Henrico CARES, thus setting a new standard for youth mental health care in the county and across the Commonwealth. Please join me in extending our gratitude to the following individuals: Dr. Rosa Morales-Theodore, child and adolescent psychiatrist at Henrico Area Mental Health and Developmental Services; Dr. Caroline Koster, medical director at Henrico Area Mental Health and Developmental Services; Mike Walsh, licensed professional counselor and program manager of youth and family services and same-day access at Henrico Mental Health; Jacqueline Smith-White, the program manager for prevention services; Amy Johnson, licensed professional counselor and school mental health clinical supervisor at Henrico County Public Schools; Dr. Julia Taylor, associate professor at the University of Virginia Counselor Education Program and co-director of the VA Partnership for School Mental Health; Dr. Rachel Reynolds, assistant director of operations at the Medical Society of Virginia Foundation and the Virginia Mental Health Access Program; Christy Corbin, president and owner of Family Support Partners of Virginia; and finally, Carrie Walker, licensed professional counselor and owner of Richmond Creative Counseling, LLC. At this time, I'd like to hand the program over to Liz Parker, Henrico County Public Schools Director of Student Support and Wellness.
Thank you so much, Daniel. I am truly honored to be with you today to share the core elements of Henrico CARES plan. We'll be highlighting the goals and action steps driving the evolution of youth mental health care services and support in Henrico County. The goals of Henrico CARES are threefold. It aims to build a comprehensive school mental health system, ensuring that every HCPS student has access to a full continuum of mental health care services and supports when and where they need them. It also enhances information sharing and coordination of care between schools, families, medical and mental health care providers, and community agencies. And finally, it simplifies the navigation of an often complex and very intimidating mental health care system for students and their families, as well as for schools and providers. So, what does this look like? Well, to do this, we have taken a multi-pronged approach that includes specific initiatives working together to address the full array of youth mental health, all of the needs in Henrico for our youth. These include Henrico County Public Schools partnering with Henrico Area Mental Health and Developmental Services and local, community, and private mental health care providers to bring clinical mental health care and related services into our schools, ensuring that support is just a hallway away for our students. This includes growing our school-based mental health staff by 5 new positions every year for the next 5 years, increasing access for all students to experienced school-based mental health providers regardless of school location. It also includes breaking down barriers by offering all middle and high school students access to no-cost teletherapy services at home or school, utilizing a responsible phased-in approach. Additionally, we are expanding specialized support to increase access to parent-child interaction therapy, or PCIT, that strengthens the bond and positive interactions between our youngest learners who are experiencing behavioral challenges and their parents and caregivers. Additionally, we are cultivating existing clinical expertise by offering a number of school counselors and school social workers who qualify annual no-cost clinical supervision towards earning licensed professional counselor or licensed clinical social worker licensure. And we are handpicking the best evidence-based programs that address mental health, substance use, and youth violence, ensuring our school-based approaches are as effective as they are innovative. We're rolling out programs that build mental health literacy for everyone, from students to staff, to parents and families and caregivers, and local organizations, as well as members of the larger Henrico community. We are slowly phasing in the opportunity to get ahead of potential mental health challenges by identifying students through universal screening efforts who might need a little extra support before they or their families even have to ask. And we are developing seamless, supportive handoff protocols and universal referral pathways between HCPS, Henrico Area Mental Health, and community and private providers to streamline student and family access to necessary services. We are also supporting HCPS students without an existing mental health provider every step of the way as they return or transition back from inpatient or residential treatment by offering and securing no-cost, brief outpatient treatment services immediately upon discharge. And finally, we are introducing a free virtual mental health care coordination service to provide all HCPS families and students, as well as staff, with 24/7 access to a live, multilingual care concierge that can link them directly and quickly with local, high-quality mental health providers and services matched to their unique needs and preferences. A virtual self-service search tool will also be available to locate verified providers independently for students and family and staff who would prefer that method. As you can see, Henrico CARES is an example of what we can accomplish when innovation meets dedication and blazes the trail, prioritizing youth mental health in a way that advances and promotes both access and equity. And while other localities across the state may address one or two of these elements, Henrico CARES stands alone in its leveraging of strategic partnerships to bring together all strategies, recommendations, and best practices identified through an extensive review and analysis of data and research into one single comprehensive plan, and that is Henrico CARES. And now, as we reflect on the profound impact of Henrico CARES and what it aims to have on our community, it is essential to remember why we embarked on this mission in the first place. And that was to address the needs and voices of Henrico's young people. So we are very fortunate to have the opportunity to hear from one of those voices today. And it gives me great pleasure to introduce our next speaker, Kenya Grooms, a current junior at Varina High School who has courageously agreed to share her perspective on the importance of mental health care support for students and how the Henrico CARES initiative may impact her own experience as well as that of her peers.
Thank you so much, Ms. Parker. Good morning, Henrico. Good morning. Good morning, Henrico County Board of Supervisors, the Henrico County Public Schools School Board, and also elected officials. Good morning. Who cares? Henrico cares. Who cares? Henrico. That's it, Henrico CARES. I am honored to be here representing all Henrico students on behalf of student mental health. I noted a few major stressors I find to be prevalent within schools. One consisting of pressure to be successful. This may sound bizarre, but yes, many students are pressured by their parents, teachers, schools, or even themselves in achieving higher academic success. Now, I can attest to this. As an entrepreneur who's heavily invested in the community, it's hard trying to balance school and also be heavily invested. But the mindset of not depending on the destination, but the journey, that mindset helps me get through when school pressures come. Second, gun violence. The trauma that's surrounded by shootings can leave harmful effects on us as students. Research shows that exposure to gun violence increases levels of withdrawal and anger within students. It can also desensitize us, in which it shouldn't, but when you're constantly presented with information from media outlets on gun violence, it creates a numbness within your sense of reality. Even though Verona is a beautiful but open campus, oftentimes I feel, am I safe here? But the trauma the gun violence leaves on us as students is hard to erase, which can cause a lack of academic motivation and lowered socialization skills. Number 3, testing anxiety. Whew. The preparation of any major test can be troublesome. The one most notable, SOLs. In schools, we learn that SOLs are meant to show your academic skills and how well you can retain information learned within the course. When taking the test, pressure is definitely applied, from second-guessing yourself to seeing other peers finish before you, and immense fear of disappointment. When students finish the test, they may worry about what their peers may say if they failed or passed. This causes students to stress and worry about their overall academic performance. Many of my peers equate their academic success or failure to who they are as a person, and in most cases, confine themselves to their grades. And guess what? I was one of those students until my counselor, Ms. Butler, told me that you are not defined by your grades, but it's a token of your courageousness that you perform within the classroom. And I also noticed other stressors: substance use, whether it's smoking, vaping, and illegal drugs. Students' inability to fit in with social circles. Okay. Scared to ask questions and fear of being laughed at. And last but not least, household abuse, whether physical or verbal. In conclusion, Henrico CARES will make a positive impact on students' mental health, whether in school or out of school. The benefits of this program provide students with a wide range of support and stability. Thank you.
Thank you so much, Kenya, for sharing your unique insight and shedding light on the potential real-life impact of Henrico CARES on meeting the mental health needs of our children and our youth. And at this time, I'd like to hand the program back over to Ben Shepard, Director of Henrico County Public Relations, to conclude today's announcement.
Thank you, Liz. Thank you, Kenya. Ladies and gentlemen, one more time for Kenya. Very nice job.